Obsessive Compulsive Disorder, or OCD. It's a term we hear thrown around a lot, right? But it's so widely misunderstood. So today, we're going to dig into what it actually is, the cycle it creates, and most importantly, how it's treated, all based on clear guidance from the NHS. Let's get into it. Okay, let me ask you something. Have you ever had one of those weird, unwanted thoughts just pop into your head that you couldn't shake? I think we all have at some point. For most of us, it just kind of fades away. But for someone with OCD, those thoughts can get stuck on a loop, becoming really persistent and incredibly distressing. And that right there is the very core of this condition. So here's the official definition to get us on the same page. OCD is a mental health condition that's really characterized by two key things: obsessions and compulsions. An obsession is that nagging, unwanted thought or urge. And a compulsion, well, that's the repetitive behavior you feel driven to perform because of it. And this is a perfect example of how those two parts link up. The obsession is that intense, intrusive fear of being burgled. And that fear then drives the compulsion, the action you feel forced to take to make the fear go away. In this case, it's checking the locks, not just once, but multiple times. It's this powerful connection between the thought and the action that defines OCD. Now, let's break down that loop a bit more, because it's not just a random connection. It's a really powerful and repeating cycle that can seriously interfere with a person's life. This whole cycle really boils down to three core parts. First up, you have the obsession, that intrusive thought, maybe a fear of contamination from germs. Second, that thought kicks off this intense emotional reaction, like major anxiety or even disgust. And third, to try and get rid of that awful feeling, the compulsion kicks in, a behavior like, say, excessive hand-washing. And these obsessions can be about so many different things. It's definitely not just about a fear of germs, which is a common stereotype. It can be a deep-seated fear of harming someone, even by complete accident. Or it could be this overwhelming, powerful need for things to be perfectly symmetrical or in a very specific order. And in response to those obsessions, people develop all kinds of compulsions. So that fear of contamination we talked about, that can lead to constant hand-washing. A fear of causing a fire might lead to checking the oven dial again and again. It can also be less obvious things, like arranging objects just so, or constantly asking other people for reassurance to try and quiet that anxiety down. And here's the really crucial point, the part that makes this a trap. Performing the compulsion brings a brief moment of relief, but it's only temporary. It doesn't actually solve the problem. The anxiety always comes back, and often it's even stronger than before, which just forces the person to repeat the compulsion, locking them into that cycle. But, and this is so important, that cycle can be broken, which brings us to the most hopeful part of this explainer, the proven treatments that help people regain control over their lives. The two main treatments are talking therapy and medication, and a lot of the time they're used together. The most common type of therapy is cognitive behavioral therapy, or CBT. For medicine, doctors often prescribe a type of antidepressant called an SSRI.
So let's look at CBT a bit closer. The whole goal here is to work with a therapist to face your fears and obsessive thoughts. But, and here's the key, without performing the usual compulsion. Now, that's really challenging for sure. But by sitting with the anxiety, you learn that it eventually fades on its own. And that's what weakens the power of the obsession.
Medication works on the brain's chemistry. SSRIs, the type we just mentioned, work by increasing the level of a chemical messenger called serotonin. It's not a quick fix, though. As you can see, it can take up to 12 weeks to feel the full effect. But for many, it can significantly lower the intensity of the anxiety and the obsessive thoughts. So, knowing that these effective treatments exist, the most important thing is taking that first step to get help. It can feel really daunting, but the ways to get support are more straightforward than you might think. Before we get to the how, it's so vital to talk about why people sometimes hesitate to get help. This quote from the NHS is so important. OCD is a health condition, just like any other. It is not a character flaw, and it is never, ever your fault. So what are the practical steps? Here in the UK, you have two main options. First, you can actually refer yourself directly to an NHS talking therapy service online without needing to see a doctor first. Or second, you can book an appointment with your GP. They can assess what's going on and refer you, or talk about whether medication might be helpful. And this really is the key takeaway. OCD is a condition that rarely just gets better on its own. It really requires treatment to manage effectively.
But with the right support, people absolutely can learn to control their symptoms and dramatically improve their quality of life. Seeking that help is a real sign of strength.
Please remember, this summary is based on information provided by the sources and is for educational purposes only. For any medical advice, please be sure to consult a healthcare professional.
If you found this explainer helpful, please like and subscribe for more. Thanks for watching.